Let it be 27, you mark it in your calendar. Or it is.
কৰ্কট ৰোগ প্ৰতিৰোধৰ প্ৰসাৰৰ বাবে এক শক্তিশালী পদক্ষেপ হিচাপে প্ৰতিশ্ৰুতি কেঞ্চাৰ এণ্ড পেলিয়েটিভ ট্ৰাষ্টে নেমকেয়াৰ হস্পিটেলৰ সহযোগত আজি এক বিশেষ টীকাকৰণ অভিযানৰ আয়োজন কৰে, য'ত 60গৰাকী ছোৱালীয়ে HPV ভেকচিন লাভ কৰে। এই ভেকচিনবিধৰ নাম কাৰ্ভাভেক, যিটো ভেকচিন 9 বছৰৰ পৰা 15 বছৰ বয়সৰ ছোৱালীবোৰে ল'ব পাৰে। এই বয়সৰ ছোৱালীবোৰক দুটাকৈ ড'জ দিয়া হ'ব। এই ভেকচিনবিধত কোনো ধৰণৰ পাৰ্শ্বক্ৰিয়াৰ প্ৰভাৱ নাথাকে। ভাৰতত প্ৰতি বছৰে প্ৰায় 80,000 মহিলাৰ প্ৰাণ কাঢ়ি লোৱা চাৰ্ভাইকেল কেঞ্চাৰৰ সৈতে মোকাবিলা কৰাৰ জৰুৰী প্ৰয়োজনীয়তাক সম্বোধন কৰি অসম চিকিৎসা মহাবিদ্যালয়ৰ প্ৰসূতি বিভাগৰ অধ্যাপিকা ডক্টৰ গায়ত্ৰী গগৈ আৰু নেমকেয়াৰ হস্পিটেলৰ সহকাৰী অধ্যক্ষ শিখা শৰ্মাৰ নেতৃত্বত এই প্ৰতিৰোধমূলক স্বাস্থ্যসেৱাৰ আয়োজন কৰা হয়। চাৰ্ভাইকেল কেঞ্চাৰ ৰোগীৰ অধিকাংশৰ বাবে দায়ী HPV 16 আৰু HPV 18ৰ দৰে উচ্চ বিপদজনক ভাইৰাছৰ প্ৰজাতিৰ বিৰুদ্ধে এই HPV ভেকচিন অতি ফলপ্ৰসূ।
I'm Dr. Gayatri Gogoi, Associate Professor of Pathology at Assam Medical College, also an adjunct faculty, a scientist to Northeast ICMR. I have been associated with an organization that works for cancer, which is Pratishruti Cancer and Palliative Trust, since 2017. So as a person, I'm a cancer researcher and as well as working with Pratishruti Honorary Program Director. Our role is in overall comprehensive cancer care in the community. We have a state-level cancer awareness program. Then we do provide support for screening. So far as Government of India's guidelines, 3 cancer screenings are done. This is for oral cancer, breast cancer and cervical cancer. Today this camp is related to cervical cancer, which is the second most cancer in female, where every 8 minutes one woman die of this disease. So there is only one vaccine so far to prevent cancer. As we are aware that human papilloma virus is the cause of this cancer, so there was development of vaccine. Earlier the vaccine was available, but it was not produced in India, so it was very costly, which was produced, those brands were produced in USA. Now as Serum Institute of India has produced vaccines, which is you can see in the this is the vial, where serotype 6, 11, 16, 18 are available, which can prevent 85% of HPV related cancer. Now as it is more cost effective, and Pratishruti Cancer and Palliative Trust is a non-profit making organization, we are purchasing in a lower cost, and this vial is used for 2 girls. Now that is why the amount, the cost associated, which is much lesser than the earlier. Through this actually vaccination camp, our target is to cover large number of population. Then only that the impact that we desire, that that will come down. Say after 20 years, if we are able to vaccinate 90% of these girls from 9 to 15 years, but we are covering up to 30 years here, because the Government of India guidelines in community is from 30 years there should be screening. So before that, whoever is willing to take, we are offering this vaccine with Indian Medical Association and Federation of Obstetrics and Gynecological Society of India. So we have done 500 vaccinations so far for this age group, and for 9 to 15 years, 2 doses are enough, but for above that age group, 3 doses are required. For 2 doses, if today is a 0 dose, after 6 months, second dose is required. For others, it is today is a 0 dose, then after 2 months and after 6 months. As you are aware, Northeast is also called capital of cancer, because if 1 person out of 10% develop cancer in average in India, But someone from the northeast, say today we are sitting in the capital of Assam, uh, in the district is Kamrup Metro. So one person every 4 or 5 person develop cancer, which means we have double the numbers of cancer than the national average. So our emphasis should be, our preparation should be much more than the rest of India.
My name is Chandrani Sinha. I'm an independent journalist. I cover climate change, health, gender. I'm here basically to talk about the stigma related to HPV virus, and a lot of the burden comes on the woman because woman is the front face of this disease, and it's a very common cancer. If we talk about it, it will be the second most common cancer among women, and that's why like we need more awareness regarding it because in Assam only 1% of vaccination took place, and we need the percentage to go high because every year 80,000 women they die because of cervical cancer. And my appeal is that everyone should talk about it. It should be a dinner table conversation in the family regarding the impacts of HPV virus. And that's why we should encourage our peers, families, everyone to come forward and take the vaccination.
পৰা প্ৰতিশ্ৰুতিয়ে কেঞ্চাৰ প্ৰিভেনশ্যনৰ কাম কৰিছে মানে আজি যিটো আমি ষ্টেপ লৈছো আফটাৰ 10-20 ইয়াৰ্ছ যিটো অপূৰ্বদাই ক'লে যদি আমি লাৰ্জ নাম্বাৰত কিয় কৰিছো অকল চেম্বাৰতে যিটো কৰিছে তো কৰি আছে লাৰ্জ নাম্বাৰত কৰিছো যাতে ইজনৰ পৰা সিজনলৈ ইনফৰমেশ্যনটো যায় নালাগে
Yes, I would definitely ask all my friends and my peers to take the vaccine. Since I have been associated with this organization, so I don't have any kind of stigma associated to it. And I was a biology student, so I know all about it. And as soon as I heard about this vaccine, I was all up for it that I want to take the vaccine. I have asked all my friends to take it. Some of them has refused, but I have told a lot of my friends, and some of are really up to it. They want to take the vaccine, and if it is provided in their reason, they would take it.
গুৱাহাটীৰ পৰা মীনাক্ষী বৰুৱা আৰু দিগন্ত কলিতাৰ ৰিপৰ্ট NDS নিউজ